Good evening and welcome to Alwaili channel. This is Alwaili Cultural House. Tonight we are going to talk about the anxiety and the risk management causes, and at least we are going to as well talk about the line of management and line of treatment. So welcome again, and we are hopefully we are not going to talk a lot, and we are not going to take your time. So some actually patient ask us anyway if we could having a brief lecture about the anxiety and the causes and the line of management, as obviously that is affecting a quite a number affecting our communities. So we are talking about today anxiety. Some people they're asking about the anxiety. We are going to be very brief, as I said in the beginning. Anxiety, actually, that is kind of a disorder that it could probably start in childhood, affecting the girls is more than the boys or the male, and some people they are sometimes getting mixed between people occasionally getting anxious, and some people they are truly having the anxiety. So in general, the people having kind of intense or excessive or persist worry or fear about everyday situation, so that basically the anxiety disorders can interfere with daily activities and be difficult to control. And that kind of issue is more affecting actually people in young people and middle age, and sometimes affecting the people after the 65 or 70s. Sometime when we're getting a kind of a sudden onset of kind of a stressful point in your life, that it can be defined as a panic attack. So the person having experienced some kind of fear that it comes suddenly. We will talk about it in a little bit detail later on. Most of the patient coming to the clinic and asking about the causes of the causes of the anxiety, and in general there is no a true, put it that way, causes, or the causes is still not clear, and that put the patient asking and questioning him or herself about it. But the life experiences, such as the trauma event, appear to be as a trigger for the anxiety disorder. People already prone to become anxious. Some people having family history and can be a factor as well as. But still, anyway, anxiety is a link of to understand the health issues, some medical issues, some medical problem associated with anxiety, like heart issues, diabetes, thyroid problem, asthma, and sometimes can be triggered by certain medicines and medication. So it's not kind of single issue or a risk single factor. We do have some factor that affecting the affecting the anxiety, or can be triggering the anxiety, or as a factor that could probably push the symptoms up. We found anxiety is more affecting the women, and that can be one of the factor. Trauma, and especially in childhood trauma, like child abuse, as well as we call it a traumatic event in a childhood that put the patient at a high risk of developing an anxiety disorder. Sometimes that affecting the adult, which is actually can develop a serious complication if it does happen in adulthood, which means age people having or more than 65 or 70s. Stress is a serious really health condition, and a big event or like a building up a smaller stressful life situation may trigger excessive anxiety. Can be probably caused by, I would probably say, the personality. People having a personality disorder, they are having this issue more prominent. I would probably say other disorder, people with other mental health issues, people having a depression, more likely having these symptoms. More recent study actually found the family history, as I said in the beginning, it's a genetic, or it can be really a familial, and that can actually causing that, or can be trigger, or can be kind of I would probably say linked to that point, which is in general come to a conclusion that it could make these issues really severe. I would probably say, if I could talk about I would probably say the sign and symptoms that I guess some people, they don't recognize this is as an anxiety. Some people they probably recognize it as a kind of a personality disorder, but in general, I would probably say an anxiety can be actually recognize feeling anxious, feeling like powerless. You don't have that power, you don't have that energy, you feel yourself weak, having a sense of impending danger, and that kind of a panic or in a doom, which is as well causing that, having an increase in heart rate, a breathing rapid, we call it the hyperventilation. You feel sweaty, and basically that you could feel it in your hands, feeling weak or tired, and that usually affecting at the time of the attack, when we're talking about the panic attack, and trouble thinking about anything other than the person's is just worry. Keep thinking about and make him or herself really worried about. If we are talking about the treatment, actually the treatment coming in two major lines. we found that psychological questionnaires is very useful, very helpful in both situation in diagnosis of the disorder, as well as rule out the other condition, and as well as that will make it easy for us, for the doctor, to eliminate the other causes. Before we start with the treatment, patient comes to the clinic having the symptom we talked about. We need kind of a test we need to do. As I said, that it could be related to the heart issue, it could be related to the thyroid issue, it could be related to certain drugs the patient taken, as far as that affecting in a young people. So a basic blood test that might be really necessary to exclude all the underlying causes, and then after that we will probably consider if we eliminated all these possibilities, then I think the treatment can be applied. We call it a psychotherapy and the psychology, and basically that kind of a treatment we just talk about the illness. It's basically it's talking to the people, and that eventually by itself, I would probably say very, very, very important, and I would probably say I could probably consider it as one of the main line of management. I could probably say that the majority of these illnesses managed by the psychologist or the psychotherapist by talking, and that kind of we call it like the cognitive behavioral therapy is one of the most effective form of the psychotherapy for the anxiety disorder. So focusing that on the skill that can return to the activities patient like can do or avoid to do or really scare anyway to do that. So that is one of the main line. Number two, which is the medication, and I think I could probably say that that line can be discussed in a thorough way between the doctor and the patient, and we found some actually medicine that is very effective, but the management or the treatment as a direct line of management, we put it as the second line. In term, theoretically, we believe the patient can improve by talking to the patient and explore the causes, and you could implement the plan and strategies to fix the issues. Medication come in a varieties of condition. Our line, sorry, I would probably say the kind of a chemical like the antidepressant, which is like they influence the activity of the brain chemical. We call it the neurotransmitters, and through that play a role in anxiety disorder. The antidepressant used to treat anxiety, including, we call it, I think people having this issue, they know these medicines, like we call it the fluoxetine, like the Prozac, and the Impramine, which is the Tofranil. These some medicines, they are actually new. Some of these medicines, they are actually been in the market for almost 30 or could be more 40 years. Medicines that can be used, we've got like a short-term medicines when the patient presented to the clinic and having like sort of a panic attack, that it treated for shortly for probably a few days, and then we bring the patient back to the clinic to explore the conditions, and as well as to consider the treatment if that treatment basically required for a long term. So a good doctor-patient relationship, and that can be eliminate and explore the patient life, and that will help either in choosing the medicines and as well as following up the effectiveness of these kind of medicines. We use, as I said, in a way like a short term, like the some medicines, the benzodiazepine, and that usually work for a short term, like a Xanax. Then we could probably consider the long term medicines, and that can be liaised between us as a family doctor and the psychiatrist. We could probably sort it out by a telephone, or we could probably, if the condition is very complicated, or patient has got a multiple issues rather than the anxiety, so psychiatrist review can probably be applicable, and patient can be sent to get that assessed. The main line of, I believe it, in terms of as a family doctor, what it is required and what is need to be done, I would probably say we always asking the patient to be really active. We found make the brain busy with a really useful thinking by like reading a books, or make yourself busy by doing some kind of work. So when the brain get it interrupted, so then you could help yourself, and you could probably eliminate the symptom, and making that the brain more effective and more conscious. We found this the smoking can be one of the factor, and that basically making the brain active, and making the brain lack of sleep, or probably some people, the smoker, they know that really well. They could have probably even spent a time doing that, and that in general affecting the anxiety and the treatment as well. We found the relaxation technique, and like by taking a deep breath, like meditation. Some people, they even do the yoga, and so choose the most appropriate a program that will suit you in terms of a time, suit you whether you like it or not, suit you in terms of you find it effective, you find it more useful. So that's kind of things that is really required. Eating healthy foods, nutrition, and we found that is very effective. People having the anxiety, they are having kind of a nutritional problem. Sometimes we call it anorexia nervosa, that is kind of the anxiety issues. So people, they don't like to eat, they don't like to drink, and that later on affecting the health of the body in general. We found the socialization very important, and I guess that is different from community to the other one. And I found that the risk of the anxiety, and I found as well as the depression affect as more or less than the people lives alone, or they don't have enough support, or if they even don't have a close family support, like parents, brothers, sisters, community as well. That is very important. At the beginning, we discussed about the panic attacks, and that is kind of attack that could occur at any at any time, and panic attack usually comes in a sudden way, and the symptom usually lasts not more than 10 minutes. So the patient feeling like the heart racing, you feel sweaty, trembling, as well as sometimes feeling a shortness of a breath, you feel chilly, that kind of symptom, and the patient feel in a danger where there is no obvious danger, and that can be treated very easy for the doctor when the patient come up. And in general we advise the patient to do certain maneuvers, and when the medicines is required, we give the medicines. I need to mention something here, that the patient-doctor relationship is still the main line of the management. Actually, the mental issues, I guess that might be different from the physical issues, and in general, the mental need to have a very close relationship between the patient and the doctor, and to explore the patient life in a way that we could probably reach to the factor as where is the triggers, and that can be concentrated on, that can be treated. In general, we ask the patient to be whenever there is issue, we ask the mothers, we ask the parent, and if you find your kids having kind of this issue, please don't hesitate to contact your local doctor and get the advice. And I guess that can be actually sorted out, and we are having a very good relationship between the psychiatrists and the schools, and we do have some patients having these issues, and these kind of relations actually make the management almost very successful, and that will help to prevent any possible complication with this condition. Thank you very much for all the people actually watching us, and actually if you do have any questions, so you could put it down for us, and then we could answer this question, and we'll get back to you until we see you for the next event, and that hopefully coming in a matter of a few days. Thank you very much for watching.